how are you? I am here in physical therapy. This is Susan Rutledge. She is my PT, and what she's doing is working on my scar tissue from my surgery I had in May, but she also last year worked on the scar tissue from my reconstruction, which has been so fabulous because it was so tight and hard before. Now it's the skin is movable, and I guess there's blood flow into it because it alleviated the pain that I was feeling in that area after, you know, the surgery had been done back in, I think, 2003. And we just never, you know, I never knew that's what it was. And it was very hard in that area. And now it's movable, the skin moves, and she'll just explain to you about it as she does what she does. Thank you.
So, after people have surgeries, scar is going to form, which is a good thing. We want the scar to form because it helps us heal. But what happens is sometimes scar can form and it can kind of bind down to things that are below it, like muscles or bone, just the different structures that can be below. So people can have pain because the nerves get caught up in that scar tissue, because different things along her back can get caught up in that scar tissue, and then just her skin can't move and the muscles below can't move how they should. So what we do is we try and release the scar from everything below it and then make it so that the scar can move just on its own. So some ways that we do it, and what we've been doing with Dawn, is we just try and pick up that skin and release it from everything that's below. This can be a little bit painful, but we work within the tolerance of each patient to make sure that they stay comfortable. And we also do some deep work to make sure that the scar is released from the muscles and the bones that are below.
And how soon, it doesn't even matter, like timeline-wise, like I had that surgery in 2003, I started with you in 2009, so it was already 6 years I had gone through this uncomfortable stage.
Yep.
And so it doesn't matter how long you've had the surgery. It can always be worked on.
The more recent the surgery, the
easier
the
it comes back.
faster we usually have good results. But we can still work on scars. I've worked on scars that are 40 years old, and we still can have good results with that. For how soon we can work, you want to make sure that everything's healed up and that the oncologist is okay with us working in the area. And we also have to be careful over skin that's radiated, because you want to make sure everybody's on the same page with what we're doing, which is why at CTCA it's great, because we are able to talk with any of the doctors that we need to talk with to make sure that the patient is the safest that they can possibly be, and they get the benefits that they need.
And at any given time, at any given time, you guys can just go to who you need to go to ASAP.
Yep.
Great. Thank you, my Facebook family. Keep following. I'll let you know what's going on. It does hurt, though, a little bit. But it's a good result, so I guess it's all worth it. Bye.